I'd like to welcome everybody. Today is October 16th to the Benton-Franklin Health District Board meeting. We're still waiting for a couple more board members, but we'll move on to public comment. If there's anybody here, don't see anybody. Is there anybody online?
If you're online and you would like to comment, please raise your hand in the Zoom app. Or if you're calling in on a phone, press *9 to raise your hand now.
Anybody? Okay. All right, we'll close public comments. Senior staff comments. Anybody? Nothing. Oh, we're moving right along. There's no unfinished business. We'll go on to new business. I saw Dr. Krager is on. You want to give us an officer help update? Not help.
Sorry. Officer update. Yes.
Yeah.
Thank you. Board members. So yeah, I'm Steve Krager. I'm the interim health officer for BFHD. I had a brief update today, no slides. So just kind of an interesting thing that's been going on. It's more of a healthcare issue, but it has impacts kind of widely, which I think makes it a public health issue. So last month we had the hurricane that hit North Carolina flooded one of the main plants that produces IV fluid, so intravenous fluid for the country. It was called Baxter is the name of the company that produces this IV fluid. So, you know, if you've ever been to the hospital and they hook you up to an IV, that's the fluid that you're getting. And I think I've read different numbers, but something like 60 to 70% of the IV fluid that gets used in this country came from this plant. So it's flooded and completely shut down. That has put a lot of supply constraints, obviously, on IV fluid across the country. So this is certainly not a unique issue, but it's something we've been, paying close attention to and working with our healthcare partners to kind of make sure that they have resources to address it. Essentially, what it means, it depends on the healthcare system that we're talking about. But hospitals are going to be the most impacted. Obviously, they probably use the most IV fluid, but there's other facilities obviously that use them as well. Ultimately, it comes down to like conservation and then trying to find other sources of fluid. So that's a national problem. The FDA is working on that, trying to find other sources, make sure if we're getting supplies from other countries that it's safe, that sort of thing. So all that is in the works, but we're still having that plan is still shut down. So from Baxter is supplying about 60% of what they usually can. So that means a lot of places, especially adult hospitals, they're supplying 100% of pediatric hospitals, but adult places are having to conserve quite a bit. That looks differently for different healthcare systems. From a clinician standpoint, it might make me, look at a patient and, maybe I was on the fence about whether they needed IV fluids or not. And maybe I say like, hey, let's try and see if they can make it without IV fluids and see if they do okay. If not, we'll add them, as opposed to, just being like, well, let's just give them IV fluids. It might just give me a little bit more pause. Some facilities, are delaying potentially like an elective surgery, as those can often use quite a bit of fluid. So that's one method that some facilities use to conserve. So yeah, I wanted to give you all an update. If you hear from people like, hey, my surgery got delayed, that might be the reason. Again, there's lots of kind of work being done behind the scenes, and not necessarily public health, but again, kind of our healthcare system, as well as kind of our regional, healthcare kind of coordinating agency, trying to, make sure people have supplies that they need. There are mechanisms, for people to request kind of emergency supplies, but there's just frankly, not a lot out there. So people are having to be a little bit creative. To me, is just kind of an interesting like intersection between kind of healthcare, public health, and in the environment when we have like a natural disaster, these sorts of things, supply chain things can come up. So that's my update today. I'm happy to answer any questions. Otherwise, we can pass it along.
What's the shelf life of IV fluids? I'm just
That's a great question. I don't know off the top of my head. And one of the strategies they were looking like was extending that, right? And I'd have to look. I haven't looked at an IV fluid bag in a while, but obviously it lists it. It would list it. I'll get back to you. But yeah, there was some talk about potentially extending that if it's safe.
No, I was just curious, like I said, is that something that was a national emergency type thing that we maybe, even on the shelf life, have a longer storage life and just in case of a natural disaster like that in the future? I was just curious. Thank you.
It's a great question.
All right, any other questions? All right, since we got a quorum now, let's do, could we get approval of September 18th, 2024 regular board of health meeting minutes?
I'll move approval.
Here, September 18th minutes.
Motion to get a second.
Second.
Motion is second. Any discussion? Hearing none, all in favor, say aye.
Aye.
Aye. Any opposed? All right.
Dr. Quandi is online now.
Okay,
Hello, everyone.
all right. And then we'll move on to on-site sewage rule updates.
Hello, Jody Payton. Promised you'd see me again, and you will today and the next 2 months. We do have a set of slides.
Yes, working on getting it. I'm not sure why it's not.
Okay. Okay.
It's a big green share button.
I wanted to like text once. Yep.
There we go.
Okay, nice. As I mentioned before, and you may all be aware that the state has revised their sewage system regulations. And this summary today is about the changes that we have to make and the ones we would like to make. So next slide. So there are some state changes. The state made these changes, we have to accept them at this point. So an example of that is a pump chamber. They determined that the minimum size for a pump chamber is now 1,000 gallons. It used to be variable depending on the needs of the system, but now it's just flat out one size minimum. So there's not much we can do about that one. And honestly, that's not a big deal. The only time that anyone ever got to use a smaller pump chamber was a 3-bedroom home or less in a type 1 soil. Everything else other than that had to go with 1,000 minimum anyway. There were some changes to the lot sizes, and that is a topic that I'm going to bring up next time. Today's intent is just to go over the ones that we have here that were stricter than the state, and the changes that we would like to make.
Excuse me, everything else is grandfathered and this is where, are we just talking now forward?
Yes.
Okay, thank you.
Yeah, right. So the biggest change that we want to make is to align with the state and the WAC that they have. And one of the, like I said, the biggest changes is the depth of vertical separation between the bottom of the trench and the beginning of any sort of restrictive layer, which could be basalt, it could be groundwater, it could be caliche, just something that's going to prevent the water from continuing to move down. So we have 4 feet, and this can be pretty prohibitive when people are trying to put in a conventional gravity system. They need to have 4 feet of soil underneath that trench. And so sometimes they don't have it and they have to go to an engineer design system. Or if they're trying to subdivide their land and they need to show that they have at least 5 feet of soil to allow for a 1-foot trench and 4 feet of vertical separation. And so this gives them a whole another foot of wiggle room where they can now proceed with subdividing their property. And also by conforming with the state it allows some of the newer technology to be used that in our old regs, we did not allow. So this will allow people the advantage of being able to subdivide and get other systems on their property. So, okay. Slide. So there were a lot of definitions that changed. And whenever we had a definition of our own that was the same as but different, we proposed changing to the state's wording. There are a few that we have that the state does not. And we also have the new definitions added that the state requires that have the most relevance to us, like the pump chamber. Next slide. Another one that the state added was a definition of a minor repair. And this is something that does not require a permit. And so what you see on the board is things that would be considered a minor repair that they would not need a permit for. And that would be if they needed to fix the lid on the tank, if the pump went bad in the system, if there was a float or electrical problem, they don't need a permit to do that. Slide. Remediation, it is allowing more remediation to be done to a system that may be failing, that they could potentially jet the lines and clear out an obstruction, and that would let the water keep going. So if there's a failure, we can look at some other options to remediate. Next slide. Another big change is that in our rules right now, we want all the septic tanks that are installed to be on the Benton-Franklin Health District's list of approved tanks. This list was started before the state had a list, but now the state has a list, and it's much more comprehensive than our list is right now. And so we are proposing that we no longer hold them to our list and that we just disregard our list. We don't have to keep that up anymore. And if it's on the state list, and if they have gone through the state approval process to get on that list, we will accept it for use in our county. The only exception that we would like to make is with the clamshell type tanks. And there's an example of one of those up there right now. And these tanks are in two pieces. And the exception that we would want to do is we don't really want the homeowners to be installing this particular type of tank. It's made out of plastic. If they try to put it in rocky ground without the proper bedding, the rocks, when they backfill it, can puncture the tank. And also all the little clips that go around need to be put on properly. It is a requirement that they have to be put together at the distributor, and then they get moved to the site. But people are getting them, they're going across to Oregon and they can buy them where we don't have that rule, and then they can bring them back and put them together themselves.
That's a BFHD proposal, but what about the state?
The state does not have that.
Say that again, they don't?
They do not have the restriction on
Exclusion.
homeowners installing.
So the state would allow it?
The state would allow it.
You're
But we are
requesting that.
requesting that they not be allowed, and it's just those tanks that have that midline seam.
Why is the state not put in that restriction versus us? I'm just curious.
Probably because at the state level, they approved those tanks to be put together at the factory, and they might not see the problems that we do with people being able to just cross over to Oregon and get them from another state and install them. So
Do we do inspections though on this install?
we do, yes.
So I guess I'm just kind of curious if, if they got from Oregon, hey, owner, you're missing 4 or 5 bolts, this needs to get fixed. Or hey, homeowner, where's the gravel at, or where's the dirt at that you're using to impact?
So when we inspect these, we have to test them for water tightness. And so they have to fill them up to working level. And working level is where the water starts to leave the tank.
Yeah.
And in order to do that properly, and according to the tank's plastic, so it needs the support of the dirt around it to withstand the water pressure pushing back against it. So they have to backfill. And if there's a leak, we can't see necessarily that they've been installed properly. And if there's a leak, it may not be evident. If it's a major leak, it's evident right away because the water just pours out like a sieve. But the slower leaks takes longer to determine.
My only concern is I know the state is typically more restrictive than the municipalities or counties. And so my concern is always that we're being more restrictive than what the state's already putting in. So I would consider that.
Okay.
Because once again, like I said, the state is typically more restrictive and pretty proactive on a lot of items that we do. So I was wondering what homeowners and other, outlying.
There's also a wall that separates the two compartments in this tank, and there's a support beam that has to be on a certain side of that wall. And I've seen it where it's not there completely, or there's these ties.
I understand. I'm just having to grasp, something that we're going beyond what the state's already requiring.
Erin has her hand
Yes,
raised.
go ahead,
Yeah,
Aaron.
let's teach me.
No, I have a question for Jody. So I just want to clarify, we're not recommending that we ban the use of these tanks, rather that the homeowners get a licensed installer to put them in. Because one thing I want to point out is we are seeing a lot of issues with these being so close to Oregon. And we don't want to put the liability on our staff to be inspecting the integrity of a tank. That's not what we necessarily do. And so it's becoming a little bit of a liability for our staff to be expected to inspect the integrity of the tank that should be assembled at the distributor. But there's loopholes kind of being found around this.
No, Aaron, that totally makes sense. Thank you for that extra piece right there. That makes sense to me. Thank you.
Right, so they can be used. And even if a homeowner does install them, we will allow that installation if they can get an installer to sign off on how it was done. So that is still allowed. Kind of our way with dealing with when that happens.
I didn't even know those tanks, because I've done several septic tanks with solid with concrete tanks. So I didn't even know those really existed.
Yeah, I didn't know either.
Yeah.
Yeah, and we see a lot of them because the concrete tanks, something changed in the 2000s. The recipe for the concrete or something in the building code for the homes with ventilation, but the concrete tanks are decaying. And so they're breaking down faster. And so someone that put in a tank 10, 20 years ago is now having to replace that tank. The last thing they want is another concrete tank. They are all going with that. And ironically, the tanks from the 60s, 70s, and 80s, those tanks are rock solid to this day. There's no decay. So it's just
Baby boomers.
You say rock solid, you mean AC/DC?
I can go with that.
So on that, I'm sorry, there was the bullet point that says alternative material tanks cannot be installed. And you described that clamshell as plastic. What are alternative materials?
Polyurethane, that's what this one is made out of. There's just a different something other than concrete is an alternative material.
Okay, so alternatives to concrete.
Yes.
Okay, thank you.
Okay. Some of the minor differences that we have between us and the state. Let's see. Okay, so there is, the state requires 6 inches of cover soil over the top of the trench. Our rules to this day have been 12 inches minimum to 24, and the state is 6 to 20. And we do not propose a change with that, to change back to 6. The maximum drain field length, right now, we can only allow 83 feet long drain field lines. By going to the state, we're gonna go to 100. which will allow them to put in longer and narrower systems without having to go to pressure distribution if they go over 83 feet. The state requires that the systems be installed in slopes of less than 30% or 17 degrees. Benton-Franklin has always had 20% and 11 degrees, so it's not as steep as the state will allow. A lot of this is because of the danger to the installers when they're trying to run their equipment on a steep slope. It's more hazardous for them to do that installation. And so we do not propose a change there. Our test hole depth is 5 feet deeper than the bottom of the trench, which puts the minimum trench hole depth at about 8 feet. So the state wants 3 feet below bottom of the minimum of the trench, but that's because they have a 3 feet vertical separation. So, I mean, we can go to 3, but we could also go to 4 too, just to give us a little more wiggle room to, if they need to do a cut, we know what it is 3 feet below that trench. They don't have to dig a new test hole. And then currently the gravelless chambers, they are allowed with the same construction parameters as gravel. The state does offer a reduction if they use the gravelless, and we would continue with what we're doing. A lot of that is because of the nitrate situation that we have in our groundwater, and we would want to continue to do as much as we can to protect and dilute that. Absorption beds, by our rules, have to be 20% larger to allow for the loss of sidewall. An absorption bed, typically a drain field, is a series of trenches that are 10 feet apart, and each trench is 3 feet wide. An absorption bed is one trench that's 10 feet wide with 3 lines that go down the middle. And we have previously asked that they be made 20% bigger to account for the loss of sidewall, but that is not a state requirement. That is a BFHD requirement. And I found an article from North Dakota that supported that, but I can't find anything locally or even within our state that requires this. So I would propose that we remove that from our rule. Another change that we would like to make that would be stricter than the state is that we would no longer allow the homeowner to design the plot plan for a conventional gravity system, which they are currently allowed to do so. They would still be able to do their own designs when it's just a tank repair. Those are pretty easy. They're not very complicated. The tank usually goes next to or in front of the existing tank, so they're pretty easy. This is an example that came in this week from a homeowner. Just the scale is off. It's confusing. It takes a lot for someone to try to figure out what is going on with that. So we would want to accept designer or engineer plans only.
So I got a question on that.
Yes.
So I understand that, that has to do with the building, even with the building departments get some crazy stuff and they have to go back and back and back. It takes a lot of staff time. Would you ever think, and I get what you're saying, and I'm not against that at all, but would you think if they came back that way and it didn't meet those requirements, you could charge them extra if they had to come back again, maybe reduce that? Versus not allowing them to do it completely. Does that make sense? Because I know in the city of Richland, they said, okay, if you're gonna have to come back, you're gonna spend more time with us, it's gonna cost you XYZ more amount. But I was just curious, did you guys think about that at all or no?
We did not.
Okay, thank you.
With regard to resident homeowner installs, the health officer is allowed to allow a resident homeowner to install their own system. And we would like to modify this. They still would be able to do their own system, but they could only do conventional gravity components only. If you had dosing or anything electrical or pump chamber, then they would need a licensed installer. That it only be installed in soil types 2 through 5, which is coarse sand to loamy sand or fine silt loam. Type 1 soil, that's the rocks and cobbles. That needs an engineer system already. I would like to see a requirement that the resident homeowner pass a test. And we would be able to charge a fee for that test, and the homeowner would need to pass with 100%. And he would be able to take the test as many times as he needed with that fee. It would be open book, it's online, and it would be 20 questions. And the questions would be related to the actual installation itself. One of the things that I've seen with homeowner installs is they just go down to the rental company and rent a backhoe, but they don't think about the size of the bucket that's on the backhoe. And so they have a 2-foot trench when they really needed a 3-foot trench, and the design was for the 3-foot trench. So then they have to add lines to that. And then another option would be to require an additional inspection. So have them install one line, and we would do an extra inspection to come out and make sure that that was installed properly before they went on with the rest of the install. And some counties will, it's all over the board. Some counties require a test. Some require that additional inspection, and they also charge a fee for it. Some of them charge a fee just flat out that if the homeowner is going to install, they pay 3 times the amount of the permit in order to do that because of the extra time that is needed for our staff to do that. And another one would be, I would like to see the risers and access to the tank on all new systems be brought up to surface grade. Another part of the change in this rule is that the homeowners are going to be required to do routine inspections and maintenance, and to dig up your drain field every single time, it's not going to support that. So by having the new systems have access at surface grade will be very helpful. Also, I would like the access to the distribution boxes to be at surface grade as well. So the top picture with the blue around it shows a distribution box. And typically that is just that box, and then it's all covered up with dirt. But when they cover it up with dirt and go over it with the backhoe, you get shifting. And so different lines may or may not get the same amount of flow of water. So this would allow them to be able to troubleshoot the system by looking inside. And also by using the speed levelers, those are the yellow things that are on the ends of those pipes. So if things get shifted inside, they can turn those dials and even out the flow of the water. This one is one that we just did recently. It was a repair because the distribution box was so cattywampus that all the water was going to one line, which failed that one line. And so we had him put in this riser around it with access up to there. And then he closed off the one that had failed and redirected the water to the other 3 to see if things would even things out and to allow that one line to dry out a little more. So, and also you can get clogs in here. It also provides access for jetting or routing out the lines. So the next set of changes are with location. What's in yellow, those are the state changes. And what's in green is where we're different. So down here at the bottom where it talks about trees, utility poles, driveways, we are a little different. But what I wanted to do here is we have a lot of struggles when there's a 5-foot setback between the septic tank and the side of a building. And a lot of times people like to run a sidewalk right across that line. And so by this, that sidewalk would not be allowed within 5 feet of the tank. So my proposal was to add the definition of impervious surface. And to add number 9 down there at the bottom. So I don't know if you can see it, but it says trees, poles, it says 5, and then there's a little 9. And then the 9 takes you back down to the bottom that says impervious surfaces shall not include a sidewalk or patio that is between the house and the septic tank, so long as the surface does not extend over the top of the septic tank and the lids are at surface grade and easily accessible. So they would be able to put their patio closer to the septic tank. They could have a sidewalk over that line. That would save both parties a lot of stress with that. With water availability, just making sure that they have a supply of water, and if they have a shared water supply, that shared water supply is approved as a public water system and is current in their paperwork regarding ownership and contact information, as well as testing. Okay, and so that's the majority of the changes that we have at this time. Yeah.
Yeah, on that last slide, what's SFW stand for?
Single family well.
Okay, thank you.
All right, yeah.
Questions?
Yes, I've got some questions. I've got some concerns from some of my neighbors out there. I contacted you about him. He's built 2 homes, one for himself and one for his mother, right next to each other. And he's been denied putting in that septic system for that dwelling for his mother because it needs to be done by a professional installer. When we allowed other people to put it in for their accessory dwelling unit, it's usually a mother or father, it's family members, and they're trying to take care of them. And I'm just want to know why he was denied putting that one in when he could put it in for his own.
The rule says a resident homeowner.
He's the resident homeowner.
He is the resident homeowner. He put in the system for his residence.
Right.
And then he also got a second permit for the accessory dwelling unit for the mother-in-law.
He did get it?
He has a permit for it, yes.
Because he told me he was denied getting that because.
No, he has the permit. We had told him that he would need a licensed installer.
Right.
Because he was not the resident of that. Well,
So he does have to hire an installer to do that.
yes.
My question is why? It's his mother, and it's an accessory dwelling unit for his mother. Why are we gonna put him to that expense as we're gonna put through that whole presentation? We're just adding up the costs for every family that's trying to put in a home, that want to put in a septic tank. The costs are gonna skyrocket when you start getting a professionally drawn drawing. Costs are going up. I don't know if anybody's realized, but the grocery bills are going up, the gas has gone up. There's no more disposable income for people, and they're still trying to get into a home, and yet we're gonna be more restrictive and we're gonna cost them more money to put it in.
Is that something, because I agree with what you're saying, because if he was doing it for like a friend.
Right.
I get it, but since he's family, to me, he should be able to be able to operate it with his be able to do it since it's his mom and dad, or if it's not, if it was like, him doing it for Clint, maybe I get that, but since his family, it should be,
It's his mother,
yeah, it's the mother.
and he's an engineer out at Hanford. I ain't gonna give his name out, but this,
That's what I'm saying, like, if they can prove that that's, hey, these are my parents, I'm the son, daughter, whatever, so.
Or I think with auxiliary, with those type of dwellings, I think isn't the state approved if with new subdivisions, there can be auxiliary type dwellings, And so it doesn't matter if it's a mother or a father or anything like that. I just think that if you're gonna treat it the same, why would that be different? If it's on the same property or adjacent property, why would we have that?
So
I'm just curious.
Aaron's
hand up.
Jody, do you want?
Oh, go ahead. Yeah, educate us.
Oh, okay. With this instance, it was not brought to my immediate attention that the 2 properties were on the same lot. 2 permits, so when they
Because
just
that's gonna
talked
start
to
happening
me,
in the future down the road for
Right.
sure.
and he owns all the property.
right. Right.
Aaron,
Go ahead, Aaron.
Sure, yeah, I think, one, this kind of feedback is helpful for as we do write this rule, we can consider those kinds of exceptions like family. I wanted to make sure to point out kind of the why behind this and why a lot of other counties have this restriction as well, is so we don't have home flippers, people who just go around and flip homes, or people who are maybe installing as a business. They're trying to skirt around the requirement of becoming a licensed installer. So we want to make sure our businesses out there that are promoting that they're installing these systems are doing it on the up and up, right? So they're not coming to us and saying, oh, I'm their friend, or I'm connected somehow. But I do think that we could consider, Jody and I can take back and consider how we could write some language to allow some wiggle room for family and those situations where it really does make sense that you'd be assisting a close friend or family member.
So yeah, Aaron, so basically what happens if someone has a single family residence on their house, it's on an acre or whatever? Because keep in mind, the state's going to allow auxiliary housing on lots. That's coming no matter what.
Right.
So if that's the exception and that's gonna happen, I could have a neighbor, it wouldn't happen in my neighborhood how where the lots are, but it could happen to where you could have this house and then decide to go ahead and build, another unit there that they're gonna rent out or whatever. So if it's on the same lot, that's the only thing is I'm concerned, whether it's mother or father, that's gonna be something that's gonna come up. It's kind of gonna mess this part up a little bit.
Yeah, that makes sense. And I think we can consider that in the language there. But yeah, that is really the reason behind that, limiting a homeowner to a single install annually is just to avoid businesses who are installing as a profession from trying to use that as kind of a loophole.
That makes sense.
That feedback will be helpful as we kind of take this back and get the final language nailed down.
So we could have put an exception to the rule if it was somebody on the same lot, family member, or we're doing an additional piece of property on that lot. Okay.
And
That would probably solve that.
will you reach out to him,
Well,
please?
that was gonna be my next ask, is knowing Jody, because I know the situation that we talked about, Justin, when I know when followed up with them. Knowing what we just talked about here, is there an opportunity to make an exception?
Yes.
Okay.
Then I have another neighbor that was getting access to pump his tank and he went in to buy riser extensions through your presentation. They don't have to get a permit.
Correct.
But they were denied the opportunity to buy the riser extensions because they weren't a professional installer by Fowler.
That's the distributor.
I'm just-
It's not,
I know, but why are they making determinations on an installer for riser extensions?
Jody, do you know what he's talking about there?
I don't, but I do know they're pretty protective of those tanks other than concrete because they maintain the liability for those tanks. And if something's not put on properly, then the liability falls back on them as the distributor.
Well, they were just trying to buy them. They have a tank installed. They're trying to buy them to get access to this to pump it more regularly. And they were denied the opportunity to buy.
Commissioner, do you mind after the meeting, can we get the name and the location of that one?
Yeah, and then third one. We're just having a lot of problems here and people are getting very upset. And what you're gonna find is they're not coming to you no more. They're just gonna do it. And if either we work with them or they're not gonna come in here. So then you better get your police force ready to go out and start enforcing it. People are frustrated out there.
Well, what'll end up happening on that though, if they decide to do that, Glenn, I believe is if they ever decide to resell that house and they get a home inspection done, it's gonna
Yeah.
cost them at the back end. It'll cost the seller a lot of money. I think through this whole presentation, we had it was a lot to absorb and, we really want to make sure that you guys are doing what you need to do, obviously to protect homeowners and neighbors and those things. We also have to look at the impacts it's going to affect on the homeowner themselves and these restrictions. That's why I was looking at the state level compared to what we're doing. If it's more restrictive or less restrictive, if you're going to ask us to approve this, you might want to go ahead and do it in more bite-sized pieces so we can absorb it and maybe one or two at a time versus, because that's not our profession. It would help us maybe to make, that way we can ask some more questions on a couple pieces at a time, if that makes sense. That would be, unless you guys are good with it, but My thing is overwhelming that much at one time.
Are we supposed to be passing this today?
Nope.
No.
Okay,
Yeah,
so
so this be in the future.
No, as we
Yeah.
talked about in the past, it was about starting to bring the changes to you all to get your feedback.
I don't like the fact that we're being more restrictive than the state. That to me shows that we're trying to step above the state regulations, and we got enough regulations. And I was always told on septic systems that we put them in at the depth that they were being put in because we wanted to evaporate.
Right.
Then what are we so concerned about? What's 8 foot down in the ground?
Because there's not everything, only the water is going to evaporate. Any contaminants or bacteria that stays in the ground. And when water starts pushing things down, on the ground, that's how groundwater is recharged, is water sinks down into the ground. It takes with it those contaminants.
And that's another concern, is the fact that I'm seeing the high nitrates, and through a presentation previous, the nitrates, it was all accredited to farming. It was farming and nitrates and farming. And I've told you, and I have the information, my mom drilled a well back in, mom and dad, when they moved here, they lived in a tent the first year. They drilled a well in 56. The nitrates were so high in the bureau that they had a blue baby. There was no farming. No farming. I've talked to one of the dairymen up there, and he drilled a well, commercial well for his dairy, all permitted and everything. His nitrates were extremely high, but since he started using that well and dispersing water on the land, and the nitrates went down. So there has to be something accrediting the nitrate level to the basalt in this area. And when it's not being discharged and recharged, then the nitrates go up. I think it has something to do with the configuration of rock and whatever other we got laying down on the ground other than farming. And I don't like farming getting that bad name of driving up nitrates, because obviously it's not true, because well drilled in 56, it was higher than ever, and now the well nitrates have came down since my mom and dad have been using that well for years. So I think we need to do some more research before we start hammering on the farming as far as driving up nitrates.
I don't think you'll find the health districts hammering on farming.
Well, there are some that are.
I might feel that way, but I can tell you that our staff, that's actually something that's very important to us moving forward, is that we're building that partnership with our agricultural industry moving forward, where we've not necessarily been focused on that in the past. So I hope you see some of those changes.
Good.
Including going to the 5Ds dairy. My mind was blown just seeing the impact of that farm and all that they're doing for Franklin County and their communities. So we're gonna keep listening in and leaning in to support you guys.
Yeah, they are spending an exorbitant amount of money. Yeah, you need to go up to Mesa
We'll love that.
and go to the carousel. And if you haven't heard about this, it's a milking parlor that goes around in a circle. It moves. The cows actually walk into the stall, but they come around to the other side. The milking is done and they back out and they go back. It's incredible. It is truly incredible. And I would encourage your staff to go up there and tour that and just watch it. It is, but the amount of money that they're spending on being very congenial to the animals, but also to the environment, is exorbitant.
Agree.
So, go ahead. I was just gonna say, so a lot of this stuff, I want to just make sure, because I sat in on the committees that Jody ran, and she had a technical expert team that was in and part of this. So this wasn't just them, it was, several other contractors and builders and others that were part of it. And I listened in, again, this is not my field, so right, just largely listening, but a lot of the discussions that came for the more restrictive things, most things were brought in line, but they were kind of due to our specific soil types or things in our area that kind of lended to some concerns. But there was always the discussion of, because we are the ones being more restrictive, there's always that exception that can be made. So it allows them to look at the permit and then start making exceptions to be able to go. So it kind of gave a first cut to make sure that people weren't bypassing and doing something that shouldn't do, but it didn't preclude the ability to, and Jody can correct me if I'm wrong, that was kind of my take on those discussions that kind of came through, of how to give it kind of a sense of that, making sure that when people were next to rivers or other things that might be of concern. So, and I think building on your comment, like, dealing at the conservation district, we deal a lot with nutrients. And one of the things that we have really been trying to hammer and change that narrative, our farmers work really hard to control their nutrient levels in their applications because it's money. It costs them a lot of money, right? And so they are the ones that are largely really watching how much nutrients are going in. What we are seeing on the rise and where a lot of it's coming from a lot of times is urban landscapes, grasses, landowners, small plots, that cumulative effect. And so, when you are talking though about density of septic systems and how many are putting in and cramming in, those are things to kind of consider. Just to add on to the conversation.
That conversation is one for farther down because that's a lot to take in.
Yeah, and I was gonna say, kind of similar to what Marcy's saying, is it makes sense to align with the state if in fact the conditions in our environment allow that. I would not want to align with the state if it's gonna harm the homeowner or down the line, somebody else that wants to purchase that property and finds all of a sudden now that they're saddled with a huge bill to do remediation. But every area of the state is very different. We have the Columbia Basin basalt, plain that we're on. So that's a lot different being Western Washington, so I would think that there are certain circumstances that would require us to be a little bit different in terms of some of our restrictions or our leniences when it comes to these kinds of systems. So I appreciate Marcy's comments because I was going to ask, what did the committee say, about some of these changes? And they're the technical people. If they're the ones that are having to live with these new conditions and they're fine with it, and there's this out, as Marcy was saying, there's, yes, but you can take a look at the conditions. The lot was owned by the same family, those kinds of things. That makes a lot of sense to me.
Just to piggyback on that, one thing I agree with you 100% is, well, 99%. There's always an exception to the rule. One thing I do believe though is even though we have people that are very educated in those fields, sometimes they want to reach a little bit more. And I've seen that in my career, and sometimes we need to back that off a little bit. So we have to give and take a little bit. We just want to make sure we're educated, we're doing the right thing. I agree with you. But sometimes maybe, I don't want to get steered in one direction and have myopia and not look at the whole picture. So we can get there, like I said, but you know what I'm talking about. Yeah. So we just want to be cautious on that and make sure we're doing the best. And at the same time, like I said, we don't want a homeowner that does something and then has to, maybe they're going to sell that house or gift it, or it was into their kid's estate or whatever. And then they find out when they go to sell it, they can't because it's so expensive. They don't have the money into it or that, to be able to pay it off. So we want to make sure we're doing some of the proactive things too, right? In the long run too.
And Carol mentioned the family again. When you and Aaron go back to wording, would you consider exploring the differences between saying resident owner as opposed to resident homeowner, so that perhaps it can, that concept is expanded to the whole property?
Any other questions? Thank you.
Thank you.
Moving on to WIC 50-year anniversary.
My name is Amy Lindholm. I'm the supervisor of the WIC program. See, if you don't know what WIC is, the WIC stands for Women, Infants, and Children. It provides healthy foods and nutrition education and community resources. So it's a program that requires both income eligibility and category eligibility. Women that are pregnant or postpartum, and then infants and children until their 5th birthday are allowed to participate in the program. It's a public health program that's been around since 1974. It's shown its success and cost savings, and it fights food insecurity. WIC serves almost 50% of all infants in the United States, so it's a very popular program. 33% of pregnant people and almost 25% of all children participate on WIC. The income guidelines are listed there. They change every year. These were from April. And the pregnancy includes the unborn child and the household size when they're determining whether they're eligible or not. 50th anniversary is this year. WIC started back in 1974 in Pineville, Kentucky. And at that time, the supplemental foods were connected to infant formula, cow's milk, cheese, eggs, infant and adult cereals, and fruit juice. And that was what it was limited to at the time. Other ways that we think of WIC instead of women and children, WIC has changed. It's a popular one around here because it changes quite often, but these are some major ones over the last 50 years. In 1976, a couple years in, WIC was able to show that infant health and reduced anemia was seen for moms and babies that participated in the program. In 1980, they did the first major change, excuse me, to the food package, and they individualized it to 6 different categories. In 1989, they began heavily promoting breastfeeding both through the USDA and WIC. In 1982, they established the Farmers Market program, which we participate in, and they also added a food package just for women who are exclusively breastfeeding. In 2004, they launched a breastfeeding peer counselor program, which we offer here at Benton-Franklin. And that involves having one FTE that's paid for out of a separate pot of money that's connected to WIC, but separate, and it is exclusively for breastfeeding resource. In 2007, the food package was revised, and woohoo, we got fresh produce on our package for the first time, and whole grains as well. In 2010, this was such exciting news. We were told that we had to get an electronic benefit system instead of the paper checks. You may remember seeing people at the grocery store using their paper checks. It took 9 years, but Washington finally got it going in 2019. Thank goodness we did, because 2020 remote services were in place unexpectedly, and obviously being able to do electronic benefits was just a relief. Yeah. So remote services began then. We had done everything in person prior to that, but then in March of 2020, we began the remote services. And then this year, the 3rd comprehensive food package change has come out. It was published this year. The state has 2 years to put into practice the changes that are required and get everything up to par. So they'll be letting us know as we move through that change. This is just a picture of the change that I think is the most important one we've seen for our participants. As you can see, those paper checks, they were taken to the store. They had to be signed in front of the cashier. They had to show their ID. Now they can put in a PIN number and swipe a card, and there's no connection to a person being on WIC versus anyone else when they go through the checkout line. Additionally, they can purchase any number of items at that single transaction versus before they had to get exactly what was on the paper check, which made it very hard for the cashier who had to send them back to go get the right item so that they could take this paper check from them. So goodness, welcome to the right century, right? But they also have a WIC shopper app, which allows people to scan barcodes and see items that are on WIC, WIC is very specific. It's not, here's a couple $100, go purchase what you want. It's very specific of which items can be purchased. And then at the bottom of the receipt, it shows what's left on their benefits, as well as on their WIC shopper app. It also shows their benefits remaining. They still have 1 month to use it. It doesn't roll over to the future months. The food package now is a little bit more robust than it was when it started. These foods are all part of the WIC package: beans, whole grains, fruits and veggies, fruit juice, cheese, cereal, eggs, infant formula, canned fish, peanut butter, milk, and cereal, and baby food. These adjust according to whether the person is pregnant or a child or an infant, and the amounts adjust as well according to the nutrient needs of that category. The considerations for change involve more than just price. They also involve what nutrients those foods offer, the product availability across the United States. All states have to have these products available in areas where the people live. The container size has to match up with what's available and what fits the nutrient needs of that participant. The participant acceptance: if the products aren't being taken off the shelf very quickly, then they don't want to require a store to have that product on their shelf, so that plays a part. And then the costs of basically managing the program and keeping up with barcodes because it's so specific. Looking ahead, the online shopping is an exciting change. Washington and one other state have decided to pilot the opportunity of doing online shopping, where a person can pay using their WIC card online and then go to the store and pick up their groceries just like anyone else would do with a debit card. They're working on a secure portal for exchanging confidential information. Right now, if someone needs to bring us paperwork that's confidential, such as a form from the doctor saying they need a certain formula or some change like that, they have to bring it to us in person. They can't provide it to us in another way. So they're trying to work on a portal for that. And right now we have waivers until 2026 where we can serve people either remotely or in person. We invite every participant to come in and have an appointment in person, but the option for remote is still available until 2026. We don't know what will happen after that. And then the expanding food choices, like I was saying, we have a couple of years to get some things made permanent, but right now it's just getting started. Another acronym is WISE Investment in Children. These notes come right from the WIC 50th anniversary website, where it says that when eligible children who participate in WIC demonstrate improved intellectual development, are more likely to be up to date on immunizations, decreased incidence of iron deficiency anemia, improved growth rates, and better overall diet quality at age 6 than those who only participated as infants. In our BFHD agency, our monthly average for postpartum WIC moms as exclusive or partially breastfeeding was 36%. That data is from 2022, so I don't know what the current numbers are, but at least 36% in 2022 were breastfeeding exclusively or partially every month. Another wise investment is in our community. The data from Benton-Franklin Health District Agency alone, 3.5, almost 3.6 million were brought into local grocery stores. $1 million of that was spent on fruits and vegetables alone. At our local farmers market, $16,000 were redeemed. 2023 began the first electronic farmers market issuance. And so this was the first year when participants could use their electronic. It wasn't exactly their card, it was a QR code. And they would take it to the market and be able to get their benefits that way instead of paper checks, which was a great benefit to the farmers too, who didn't have to collect these paper checks for the bank, get reimbursed. They could get cash immediately as well. But we issued about 35,000 and 16,000 were redeemed. As far as our community as well, I wanted to mention that we found paperwork from a Board of Health meeting in 1977 here at BFHD. So no one seems to know what year we got it, but at least we have had it ever since 77 here at the Health District. Another WIC acronym, WIC is connection. When we do our appointments, we refer families for many resources in the community, including doctors, preschools, medical insurance, maternity programs like MSS and First Steps program, housing, transportation, other food resources, immunizations, substance abuse counselors, domestic abuse, mental health services. So our visits are more than just nutrition education and food benefits. Here at Benton-Franklin Health District, we do some cross-pollination within our agency. We do a lot of connection with our children and youth with special healthcare needs. The dietitian that does the bulk of that work is the coordinator of that program. She has a 0.2 FTEs with WIC, so she's able to help families that maybe don't even know that WIC exists when they're discharged from the hospital, but she helps them get connected to our program if they are eligible. And we also make a lot of referrals to our ABCD dental program and to Nurse Family Partnership. Car seat referrals heard about frequently. We send people to Care Connects for Medicaid assistance if they need it. And we attend some of the outreach events to share about WIC and be part of that team. We recently helped out with the alternative drinking water program, and it was a grant that was done with Jody and Erin. They our able to offer 2 filters for families whose nitrate levels are too high. And so Jody went through a list of our WIC participants and came up with the 190 families that are thought to have a potential risk for nitrates in their water. And then we contacted those families and they were given a little some test strips to get their water tested at home and determine whether they wanted to bring in a sample or not based on that. And then more on this spring with the lineage fire, we were able to help contact some of the WIC families who lived close by and needed to have air purifiers. So we do a lot of connection within our agency. WIC is committed. Our team, our staff is a nutritionist, lactation consultant, nutrition aides, and our breastfeeding peer counselor. It's an opportunity that a lot of programs don't have, where we do direct services, where we're talking to an individual with the door closed and connecting with them on what their needs are. We encourage goal setting and we do motivational interviewing. We used to be like a lot of medical care, it's changed to more motivational interviewing, where you're not being told what to do, but you're being explored with what your goals and choices are. And we've really embraced that in WIC as well. And then with the hybrid service of being able to serve people both remotely and in person, it gives a lot of people that have transportation issues, and just having to bring 3 children into a clinic isn't always the easiest thing to do. So the opportunity to remote is a great thing as well. We serve, currently our caseload is 4,830, and that's a 18% increase since January of 23. So we've really been working hard. Every quarter we have a funding increase when we have about 101% of our caseload. And so we've been able to have several funding increases over the last 2 years. This is our team, and I just appreciate each of them. This is 13.2 FTEs that just basically spend a lot of time helping families to grow and have resources. There's a lot of work involved learning the community resources to tell people about, and having the nutrition education knowledge to be able to share valid and evidence-based information with the family while you're on the phone or talking to them in person. Takes a lot of training, and doing all the pieces and policies of a big federal program take a lot of learning as well. So I'm super proud of this team for doing all the work that they do. And then it says women in the title, but I just wanted to point out that many fathers bring their kids into WIC. Caregivers, grandparents, whoever is taking care of a child, foster parents, they will have just the same rights to WIC as anyone. Do you have any questions for me?
So it is a federal program.
Yes.
Have you ever been allocated less funds than you were needing for this program?
Over the years, there's been times when they've had to cut down priorities, meaning like infants and pregnancy have the highest priority, and then children are lower priority. And if they have a health risk that's high medical needs, they would have a higher priority. And so at times they've had to say we can only serve priorities 1 and 2, but not 3 through 7. And so we've had to adjust according to those kind of.
Because you said you've had an increase up to 4,830 from what, is that in a year that you?
That was a year and 9 months. Our caseload in January 23 was 3,950.
It's that many clients each month.
Yeah, so I'm just cautioning where we're headed. And this financial is, we just got notice today that 1,200 of the stores, Walgreens are closing up. I think Commissioner Mullen, you said that another
Circle K is looking at closing stores.
So we're gonna, and we had Lamb Weston, we're gonna have more people needing this. So I'm curious, is the fund's gonna be there from the federal level to help out the public? Because it is, we're seeing the trend, and it's gonna be, get ready, because it's coming.
Right. It's feels like it's been ongoing for a while with the price of everything.
It's gonna get worse. Worse, I can see it, it's gonna get worse.
So just real quick, one of my sister-in-laws had worked for WIC, I believe in Maine. And I didn't realize it was 50%. You said 50%. There was a number on your first three slides. It's huge. This is a huge program and it looks like it's really serving our community as well. So you should be very proud of your staff and what you guys do and stuff like that. I just want to say thank you for what you do because that supports a ton of our youth there. So it's a pretty cool program.
Thank you so much.
Yeah, I was also congratulations on the program through BFHD. I know it's very valuable. And I'm really glad that we can use the WIC coupons at the farmers markets, because I remember when I first started this, it was crazy that you couldn't. Anyway, the statistic, was it 37,000? Is that the federal poverty line? How does that relate to the federal poverty line in the United States right now? So that one of those slides that talked about 50%
Income criteria.
Yeah,
Second-
income criteria.
Second slide.
185% the federal poverty.
185%.
It's a little bit of a higher income level than some government. programs.
Okay, all right, thank you.
And there is some adjunct eligibility for some government programs, you know, if a family's Medicaid eligible, often we have that adjunct eligibility for WIC. So it helps streamline the process a little bit,
Okay.
especially with our technology.
Thank you.
Yes.
The next slide. There's 7 people in the home. And all the cards, the distribution the same. If they meet that criteria, they get the same amount of money in their card.
Yes, it, per woman, per child, per infant, yes.
When you have twins, you get twice as much.
A special formula that costs $50 a can, you get it.
And if they don't use the card's allotment that month, the card then ceases to exist and they get a new one for the next month, correct?
They always have the same card, but the benefits don't roll over.
Oh, I got you. They got the same card.
It just zeroes out and starts over there.
Gotcha.
So congrats to at least 48 years and 50 in the nation, right?
48 years of BFHD.
Thank you.
Thank you.
Thank you.
Thanks so much.
All right, we'll move on to Carla.
Okay, quick announcement, everybody. Last month, we mentioned that our FAB reaccreditation site visit dates had been set, and there is a special session for governance. So where we would like to have some representation of our Board of Health. Literally at 2 minutes after this meeting started, we got the time frame, so I can get you a time frame. So they are gonna let us do just 1 day of site visits instead of 2, which bodes well. We're happy about that, hopefully. And the governance session is scheduled on October 29th from 10:20 to 10:50. So if you can, again, if you're deciding amongst yourselves before you leave today, or check in with Janae to let us know who will be able to come see us. If we need to do remote, we can try to make that happen, but they are hoping we're challenged with their technology. We're testing it out Monday to see what it's gonna be like, but they would like to have folks here. And it looks like the governance session is literally the virtual site visitors and the governance board, so not necessarily all the staff training session. Just for you all.
So it's here then?
Yeah, we'll have to balance that with quorum. So if you do find yourself, wanting to do that, let me know so I can make sure if everybody wants to attend, then we'll make sure it's in compliance with OPMA. Otherwise we can narrow it down to like a representative from each group.
I think we should do rock, paper, scissors, and whoever loses doesn't have to go to the meeting. Or you want to arm wrestle.
This is good stuff.
You get to brag on your relationship with us and all of the great work that we do, right?
You, so maybe if you sent out like a email to individual board members, and then we could reply back to you.
So 10:29 from 10:20 to 10:50 is the session we're inviting.
So if you'll follow up with them after or.
Yep.
So you didn't reply to the arm wrestling commissioner, did you?
I might be okay.
Oh,
No.
all right. Anything else on that?
That's it.
Okay,
Thank you.
cool.
What was the time on it again?
10:20 to 10:50. You can get it right away. You'll just get it first day out, back.
I don't really go there to kill anything. I go there for therapy, recharging the battery,
Yeah.
get away from everything.
Anything else? Going to the executive session then?
Yeah.
Okay.
We have 2 executive sessions under the same topic. So the first one would be for 10 minutes to include Aaron, Jody, Chris Burton's if he's on the call.
Yes.
And myself on the board.
Okay. We'll go to the executive session. Time is 2:40 for 10 minutes. All right, we had some technical difficulties. We're gonna be going back into executive session for another 10 minutes. We didn't even get to have discussion at all. Time is 2:52. Out of executive session at times 3:05. Notices were made.
Technical difficulties.
Uno mas.
It's for 15 minutes to include Aaron, Amanda, Chris Mertens, and myself and the board.
All right, we will be going back into executive session. The time is now 3:05 for 15 minutes. All right, we're out of executive session. Time's 3:21. Discussion on good notices were made. Move on to one last little topic, approval of vouchers. Can I get a motion on that?
I'll move that the board of health payment of 2024 to 79-2024, the amount of $85,142.86.
Here a second. I'll second it. Got a motion in a second. Any discussion? Hearing none, all in favor say aye. Aye. Any opposed? All right, guys have it. Next meeting, November 20th.
So there's a walkout conference going on
Oh, yeah.
during that time frame. And so I want to find out if the board,
You know what?
yeah. Several of us want to be at that conference to follow. And so we can either go the week before or the week after. The week after is the Wednesday right before Thanksgiving.
So I'll be out of town.
Okay.
Do you guys, is it fine that we move it a week ahead?
I may not be here, but as long as.
If we can get a call, maybe send an email out and then we can reply back individually and see if that would work. Or if there's still a quorum, or if there's a quorum even during Thanksgiving.
Or a week after
Or
Thanksgiving.
yeah,
Because everybody's gonna be gone a little bit, probably around Thanksgiving time, maybe a week after. Is that what you're talking about?
Yeah, and part of it is we've got our budget, right? We've got to bring forward.
oh yeah, we gotta do that too. That's fine.
But yeah.
Oh,
okay.
okay.
Right, it takes. Okay.
All right. Meeting's adjourned.
Yay.